Recording is on.
Welcome to the Global International Pedagogical Forum, IPM 2020, which I'm representing now. My name is Lilith, and today my guest is Professor Paul Leroy, Officer of the Order of the British Empire for Service in Virus Research, Professor and Chair of Virology at the London School of Hygiene and Tropical Medicine. She attended a number of schools, which included Columbia University Medical School, Rutgers University, University of Alabama, and University of Oxford. Honorable Professor, we do appreciate that you took your time to participate to the forum and answer our questions.
Well, it is my pleasure. I like to say hello to my chairman. I don't see him, but Mr. Baranovsky thank you for inviting me. So I'll be happy to answer any question you have.
Thank you so much. Professor, although the coronavirus infection has hit the countries all over the world, there are still a lot of true and false facts about the coronavirus. And one of the frequent one is whether the COVID really exists.
Yes, of course it does. This is a disease caused by a virus called the SARS coronavirus. So SARS-CoV-2 in 2019 that started. Yes, it is caused by a virus. It's not myth. It is a real disease.
Okay, and this disease is not an ordinary flu. It is something more serious because many scientists talk about the synthetic nature of the COVID-19, that the virus was developed in the laboratory. What do you think about that?
No, it is not flu, of course, but it is not synthetic either, because if you look at the genome sequences, the spread mutation, many parts of the genome, small drift, we call it, a little bit mutations, are not possible in the laboratory to create it. It's more likely naturally mutated, probably in bats. Didn't cause disease there, but it caused disease in human, when it crossed to the human individual to infect. So no, it is not synthetic. I don't believe that. That is not possible.
Okay, so. Thank you. And then how to deal with the virus COVID-19 and what to do with the pandemic?
Well, currently we don't have any drugs or vaccine or any kind of treatment. So best way to avoid this disease or infection of this virus is to not to get in touch with the individual who has already infected. So stay away from infected person, or try to stay away and far away from anyone that you don't know. So better to be just to avoid it, avoid the virus infection. That's the best way right now, until we have some treatment. So
okay. Mm-hmm. So everything has started in China, but talking about if we could call it this phenomenon, that the China turned out to be faster and more efficient in the fight against the virus. Now Wuhan is open, and most of the countries in Europe and all over the world are in very difficult situation. So what's the reason of that? Maybe it can be explained by the fact that the China uses disease monitoring system based on the example of SARS. And is there any such monitoring system in other countries that led countries to switch the alarm and to take immediate steps to combat the virus?
Well, China had already the experience of SARS, as you mentioned, and they knew exactly what can happen next time, so they were prepared for that. But the rest of the countries in Europe or America or other Asian countries that we never had SARS, so never have to prepare ourselves that way. So it is not the same story that they have, but nevertheless, currently we are trying to controlling the virus. We are trying to control the virus, and I think that we develop the system now already through isolation or whatever way we can to stop the spread of the virus. So it is not as bad as if it happened many years ago. We didn't have anything equipment, but I think we are quite ready to control it, and we have done it. It's going on all right, slowly. But next time we will know exactly what to do, like China did quickly.
You said that we were not prepared for that. But on January 7, 2020, virologists from the Wuhan University warned of coronavirus pandemic and released into the world a fully defined pathogen genome so that everyone could as quickly as possible develop kits for researching this issue around the world. Has anyone dealt with it?
Absolutely, of course. Many of us are doing that because you know that already we develop test for virus, how the virus grows. We have the test to look into the virus infection, and also look into if somebody has infected already and develop antibody also being developed now. So yes, it was because the sequence was released, it was very quickly adapted for diagnostics and also for vaccines. Many companies and many other universities are making the vaccines now also. So because they actually released the sequence, it was very good to get it, and it was very quick for everybody to make it. So almost every country have a diagnostic kits now anyway. So that's one way to control also.
Great. Anyways, pandemic is widely spreading. At this moment, how many people actually get sick, and what is the scale of the pandemic? And I would like also to focus on the fact that it is important, I think, indicator of infected doctors and nurses. What can you tell about that?
Well, initially the virus was spreading 1 to 2 to 3 people. So it was very quick spread, but it's gone down now. And in fact, we have now worldwide, we have at least 3 million people infected, and over 250,000 people died. So it's because we are not ready that time. But now we know that how to control, at least to stop, to go near an infected one. Nurses and other workers, they have to work with the patient. They have to be much more careful. And they're very much close association with the patient. And that's the real danger, of course, and that's what they are getting infected. But with proper PPE protection equipment, it is not so bad if they take care of themselves properly and if all the equipments are available. But you have to understand the SARS kills, of course, but it's still 80% people recover if they're infected. So it is not as bad as we think that it is happening. But yes, of course, we are not prepared at all. But there are other diseases caused many years ago, 1918 flu caused a lot of death. We don't have that. It's altogether about 3 million people now, died in all over the world altogether. So still, percentage was much less. So does it, is that satisfy you, my answer?
Yes, sure. Sure. So as far, what do we know about COVID-19? There are some facts. We know that the average incubation period of the virus is 5 days. The maximum period is not known exactly. We know risk groups, men and women of the age over 60. We know that asymptomatic carriers can infect other people. We know that vaccination against coronavirus infection have never been developed as far. What else can we add to this list? And if it's correct or not, please correct me.
Well, first of all, yes, incubation period could be up to 10 to 14 days even. Now, other problem, most important thing, I think, because many people don't get any symptom of the infection. And so it's very silent. So you cannot differentiate between the people who don't have any symptom and people are not infected. That is the problem. So if we do the mass scale diagnosis, then we will know. Particularly, we will know who is infected, who is not infected. And once we have these antibody tests, what you call serological test, because once you are infected, you generate antibody. And if you have the test for that, then it is easy to say immediately, oh, they are infected, they don't have symptoms, but they're infected, so they're not dangerous. They can touch people, do things. But the people have not infected, they may get infection if they go near the infected person. So this sort of thing, one have to be careful about this virus, you know. So because you don't see the symptom always. That's the most difficult thing, I think. To my mind, it is the most important thing that we don't see someone has any symptom. Or the other one, like husband, wife, husband got infected, seriously ill, wife have no symptom. But as a virologist, I will know for sure that this person, wife, will have the infection, but no symptom. So that is a difficult issue, really. But the kids will do it, and then once we have vaccine, then we can vaccinate everyone, you know. Then we have no problem. We prepare for that. Yeah.
And what about the immunity? Does immunity develop after the virus? And if so, how long can this immunity protect us?
Well, immunity will protect definitely. Virus will, if somebody is infected, they will develop immunity. Definitely, they will have the antibody response. Antibody response, they will have immunity. And if you have the infections, you got the infection, you will have the antibody, and that can protect from the further infection. You don't know exactly how long you will have the immunity, but if you have say, for instance, if you have a high-level virus infection, some people have very few viruses, they have less immunity they will develop. But the people who have large load of virus, they will develop most likely strong antibody titer, high antibody titer we call, a lot of antibodies, and they'll be very strongly immune against the virus. So in any case, you cannot be infected immediately, not possible. That one has an infection, then some people are talking about that, I hear, that get reinfection. It's just not possible. Virological point of view, it is not possible. Because we have developed the immunity, means we have the host developed the fighting armor already, you know, so cannot allow the virus to go in. So this is the reason it is not possible to reinfect it immediately. A single person.
So does it mean that that people who have had coronavirus infection cannot sick again?
No, they will not get infected by the same virus again, not for a while. It could be 6 months, 1 year, or longer even. We don't know how long for they will have this immunity, but that will have to be assessed. You know, I'm sure that some people, some researcher will test it all. Now we have this infection going on, so these are interesting questions for us. That how a certain individual is making the antibodies and how long they can sustain this immunity in the body. That would be a very interesting question to see. Yes.
You mentioned that pandemic is down now. So will summer temperature really help us to stop the flow? Is that true?
Yes, in a way, because virus will be less capable to infect and transmit, because generally it's a droplets, you know, the hot temperature, they will die very fast because virus needs to latch on somebody to survive. And in a hot weather, how many droplets will have how many virus survive outside? is a question, because temperature, the virus generally doesn't grow in a high temperature. So it will drop, less capable, I think. Of course, I think the hot temperature will slow down the virus transmission. Yes.
Mm-hmm. And what about the treatment? So far, it seems that no effective treatment has been developed. We already know that this is an unusual virus, but we do not have a fundamentally new treatment.
Yes, because we don't have drugs yet, but I'm absolutely sure that we will. A lot of the drugs are in the pipeline. They are now testing different drugs that already have been used in a different infection, but they will be targeted for coronavirus, this particular virus, SARS-CoV-2 virus. We will have the specific drug. And as many are working, many companies, pharmaceutical companies, and the university scientists are working towards that. So we will have the drug, I'm sure. Mm-hmm. So not now yet, but now you have to be isolated. That's it.
And why is COVID-19 dangerous?
Because this virus is the first time we are seeing the virus seeing us for the first time. So taking over us. So generally what happened, once you have the virus have infected us, we will have some immunity already. So as I said, they cannot infect again, but this is the first time we are exposed to this virus. And virus is taking advantage. They're just wiping us out. They're just going in everybody's body doing things, but they will have to stop once we have the immunity. They won't be able to do that. That's why it is the most dangerous for us, and because also it infects person to person. It doesn't go. There's some viruses like mosquito have to bite you and then they will transmit the virus wherever the mosquito is. But here this is not, or animal will contact will do that. But this one is not. It's going human to human. So two scenario: one, because one going in contact would spread it, and secondly, there are nothing available that we can stop, and it's the first time the virus, we are exposed to that virus. No one has immunity at all against this. So that's the reason it's dangerous right now.
Okay, can we, because it's a lot of said about that, but can we repeat again, how can you get COVID-19 and then what measures should be taken to not to suffer from it?
Well, generally, you get this virus infection through infected person, from an infected person, droplets, and also aerosol from the, somebody really too near and has a spitting or all this, or big breathing, whatever, virus comes out, that will contact you. So main thing is the contact with another person, too near, close contact, and several hours contact, even worse. So the best way to do it right now is to stay away and not to go in a big gatherings. And the best measurement that we are all taking all over the world, this measure that people are taking it, isolations or distance. That's the best way to do it right now. But it will be only for this year. I'm sure that we will have something, vaccines come up soon. So that they will not win, the horse will not win at the end.
So do you think that self-isolation is a good measure?
Yes, it is a good measure because we have no choice now. As I said, we have no other choice, no treatment. So that's one way we can avoid completely. Not to come in a contact with another person, because we don't know the person has the virus or not. Not everybody showing symptoms. That's the problem. So, yeah.
So when will the vaccine appear at last?
Well, I'm sure some vaccine will appear in end of this year. Next year, several other will come. It's a human vaccine. They have to go through certain they have to be cautious that they're good and safe, and have to have clinical trials a little bit. That's not so easy. That's why it will take a little bit time. But vaccine has been made by many people already, but the manufacturer have to make large amount, downstream processing and testing. That takes time. I will think about another year, 18 months maximum, we will have several vaccines already. I'm sure about that. In England, we're having one. We're thinking it will be ready by end of the year, definitely. So they are in the pipelines. And I'm looking at vaccine also. Very safe one. My research group making one, yes. Very different kind. One is in the market now, yes.
Great news. And one more last question. Can coronavirus destroy humanity, human generation? Is it possible?
Well, no one can answer that. I don't think so, but I don't think anybody can really answer that question properly. What do you think? Tell me. In your common sense, what do you think?
I hope that it's not.
No,
I hope that humans are smarter.
of course. And right now, if you think about it, it's how many billion people we have in the world. We have only, up to now, we have only 3 million people died, right? No, 3 million people infected. 250,000 people died. So it's very, not very many yet. So I'm sure that we will, when you have the rest, human going to win at the end. Absolutely. I have no doubt about that. It's not going to happen. They're going to wipe out that. But people have to be a little bit patient about that, and careful what we do. This is very, very important to think about. It doesn't mean that you have to be very, very worried and fearful about everything. That is also not correct. It is not as dangerous as we think. As I said, 80% of people are recovering from infection. They have very mild disease. Many have very mild disease, not so bad. Not more than the just common flu, So it's not as bad as dangerous as we think. It's only dangerous because we don't have the immunity against it yet. And so the way everybody racing for making vaccines and drugs, I'm sure we'll have it. We will, at the end, will come out well. People will be here, still in the world, and again. I'm sure about that. So I don't get very upset about those things. If you have a problem, you have to handle it. You have to solve the problem, and that's what we're doing. You have to solve this problem, and we will do it. Okay.
Okay. Thank you very much, Honorable Professor. We wish you health, be safe and healthy. Thank you so much for your time.
Thank you very much for having me. Thank you. Goodbye.
Thank you. Bye.